Well, folks, we're visiting today with Dr. Kevin Trembush. He's the owner of Advantage Health and Wellness, a physical medicine facility located in Morgantown, West Virginia, celebrating recently the 20th anniversary. Congratulations, Kevin. Thanks for being on the show today.
Thank you. Great to be here, Jim.
Yeah, I'm looking forward to learning more, about you and your business venture and how you've been doing it for 20 years. That's awesome.
Positively West Virginia. Positively West Virginia.
Positively West Virginia is powered by BreezeLine high-speed fiber internet and sponsored by Highmark West Virginia, Freedom Kia of Morgantown, and Humble Influence. With the help of these sponsors, we're able to share the positive business stories of West Virginians, including the one from today's episode.
So Kevin, again, it's great to have you with us. Dr. Kevin Trembush, tell us a little bit about your business, Advantage Health and Wellness. What do you do?
Okay, thanks for the opportunity. Again, I'm happy to be here.
Yeah.
So I'm a chiropractor. I've been a chiropractic physician since 2001. And in 2002, I decided that I was going to try to put my own thoughts and passion into my own business. And so in 2005, I was ready. And in July of 2005, we opened Advantage Health and Wellness. It was me and a few employees and a whole lot of passion and a whole lot of energy. We didn't know what we were doing running a business, but we made it work.
That happens.
It happens. So it was one of those things where you just kind of jump into it and figure it out while you go.
Yeah.
But it took off really well when we were located on the Mile Ground Road in Morgantown.
Yeah.
And before a couple of years went by, we expanded from a couple thousand square feet to 3,200 square feet. And then very quickly after that, we realized it's time to expand again. Had more employees. And ultimately, I was wanting to get it to be a multidiscipline practice. So the inclusion of other chiropractors with physical therapists and ultimately some medical services to be closely associated with it. And so that's when we moved to our current location in 2010 to Burroughs Street on the corner.
Yeah.
Downtown. And
iconic location in Morgantown.
It was
right there on the corner. Yeah.
I was Miss Bowers worked with the city and gave us a city beautification award when we took over that corner, because of course it didn't look really great prior to.
Yeah.
But it's an iconic area, like you said.
That's great. High visibility area.
Yeah. So
what got you into chiropractic and the whole idea of medicine in the first place, Kevin?
I feel like I always was an empathetic person. If I saw the elderly lady trying to walk across the street and struggling, I would drop what I'm doing and help her, kind of person. I think I care about people and their well-being, so that it was intuitive to get into healthcare in some form or fashion. But I didn't know what direction. So I started into college on that route of probably medical school, right?
Yeah. Where are you from originally?
Well, so I grew up in Glendale, West Virginia, in Marshall County.
Yeah.
Yeah, right across.
Home of Brad Paisley.
Yeah, Brad Paisley lived one block over, yeah.
All right, yeah. All right, keep going.
Yeah, so
I interrupted you.
That's okay, yeah. I didn't know what type of healthcare I wanted to focus on. And in high school and in college, I would regularly suffer with some pain in my lower back. Our family was pretty medical provider oriented. And so, it was go to the family practice guy and he would give you some anti-inflammatories. It wasn't answering the question of why that was happening though. And eventually my dad, who was probably, in retrospect, a terrible chiropractic patient, the guy who drags himself up the steps because he's in pain and misery where he can't even walk, and then expecting to be fixed, he said, why don't we try the chiropractor down the street, Dr. Larry DeGarmo? And I'd been dealing with this for a while. I was in college at this point, and he said, well, lay down there. And he just, with his hands, could tell immediately. He's like, oh, well, here, lay on your side. He did an adjustment to my sacroiliac joint. Immediately, I knew that that's what needed to have happen. And I was, at that point, kind of impassioned by the fact that he knew what to do without an x-ray, he immediately knew what to do, and then could do something right then.
Wow.
And so that kind of turned me on to, I'll look into chiropractic. And a lot of times chiropractic is a generational thing in the family, but, I didn't have anybody to guide me. So Larry DeGarmo was a big influence there.
Yeah, that's very cool. What school did you go to for that?
National College of Chiropractic, it was called then. It's now called the National University of Health Sciences.
Amazing, yeah.
I think they've expanded to many different kind of programs. But in Chicago area, Lombard specifically, Illinois.
Very cool. So tell us now, today, Advantage Health and Wellness is in its 20th year. You just had your 20th anniversary.
Yeah.
What are you known for? When people come to see Dr. Kevin Trembush, what do they come for?
I hope when people think about or decide to come to Advantage Health and Wellness that they are choosing us because they want to really find out what's wrong and get good answers, but also to take an approach that we're going to put together all of the modalities that need to happen to try to correct this at once, so that they're not going to spend time with a chiropractor when it should be a chiropractor working with a massage therapist together to get the best effect quickest. So I hope that that's what they're thinking is, I want to go someplace where they're going to look at me as a whole person and use all the different disciplines available to help treat me right off the bat.
Yeah. So you mentioned massage therapy. Do you still are you still interested in helping with physical therapy and some of those other things you talked about?
Yeah, of course. Most programs for patients that we have are going to include some combination of chiropractic with the different modalities customary to chiropractic, physical therapy, manual therapy or medical focused massage therapy. And then we do partner with advanced physical medicine, which is in the same location where we can then intervene with pain management up to but not including narcotics. We're going to try to, if that's necessary, we might work with a provider to help you there, but that's not going to happen in our facility.
Yeah, very interesting. Yeah. So when somebody comes, say for instance you meet somebody for the first time out in the community, whether it's a social event or something, they say, Kevin, what do you do? What do you tell them? What's your 30-second pitch? Yeah,
great question. I tell people I have a physical medicine facility. We use chiropractic, physical therapy. We have medical services available. We're the place you go when it's not enough to just go see a chiropractor every once in a while, but you're not ready and you're not a candidate for surgery. We're that spot in the middle there where we can try to put everything together at once and hopefully avoid that surgery.
Love it. So here in West Virginia, what are some of the injuries or maybe the ailments that you're treating most? Is it back pain, lower, upper cervical? What are the kinds of things that you see most?
Yeah, it's evolved over time, but the bread and butter conditions, so to speak, the ones we see the most of are going to be low back pain, which could be mechanical in nature, or it could be, like I said, an injured disc that you're trying to avoid a surgery. Neck pain, headaches, but we do see a lot more extremity work since it's been well over a decade now that we've been a physical therapy facility as well.
Yeah. That's excellent. This is Positively West Virginia. We'll be right back. In a world obsessed with leadership, what if the real key to success is followership? We hear it all the time. Be a leader, take charge. But what if the most impactful people aren't the ones leading from the front? In Humble Influence, I explore how humility, collaboration, and shared purpose empower followers to create meaningful change in business, organizations, and relationships. Discover the strength of true followership with Humble Influence. Folks, we're back. We're visiting with Dr. Kevin Trembush. He's the owner of Advantage Health and Wellness in Morgantown. Kevin, what would you say is the thing you're most excited about your company right now?
I'm very excited about our new providers. They're not technically all new. They've been many of them practicing for a long time, but they're new to our practice, and their passion that they're bringing it's enlivening. You can feel a good energy in there, so I'm excited for the future. Yeah, energy's good in a business, especially if you're hit that 20-year mark. It's try to keep that momentum building. So how do you do that? Is it about culture? Is it attracting the right people? Tell us a little bit about what you've got going on there. Like you're on it. The culture of any business, I'm assuming I only own a few, but I'm assuming all businesses have to have a healthy culture of energy and excitement. If that starts to go away and it becomes a mundane grind, well, your customers feel that. Yeah. And that's a big deal. So I think I think one of the biggest attributes of our company is to have a weekly meeting where we get everybody together. We try to keep that high energy. And the other part of it is too, like if you notice that somebody is just not a good fit anymore, it's time to move on. It's best for them. It's best for the company.
Yeah. So, yeah. And I think, you're a customer of somebody. I'm a customer. We're all customers, right? And we see that. We sense it in our day to day. We're out there doing business out in the marketplace. You can see the companies that have a spark and those that they need to get a spark.
Yeah. Yeah, exactly.
And I think that culture is such an important thing. And I never really understood that. And every time a business grows, every time you add a person or somebody leaves, that changes the culture just a little bit, doesn't it?
Sure does. Sure does.
How do you deal with that?
Well, we try to really systematize training so that the nuts and bolts of it are standardized, so to speak. And then you can focus on like the more personal side of them being a fit for the company and understanding the company's values and mission.
I think everything from the way you recruit to the onboarding process sets the tone for everything, doesn't it?
Oh, it sure does. Yeah, I agree.
I like what you said there. That's really excellent. Thank you for sharing. What as far as your patients go with the practice, what's the geographic area that you serve?
Well, it is physical medicine, and you have to be present.
It's
to
not
have
an
the
online
effect.
business, is it?
It's really hard to do what we do in the telemedicine world.
That's right. Yeah.
In fact, I often imagine like how exactly would you get somebody to adjust themselves over the phone? So because your presence is necessary, and by the way, there is no magic to this. Like it's repetition over time, right? And a lot of people struggle with the concept of being in a doctor's office, so to speak, a few times a week for a little while. But it's that keeps our geographic pool to, close to Morgantown area. I bet some people will drive up to a half an hour regularly.
Yeah.
And on a more rare occasion, we'll get people that drive 2-3 hours just because they're in a rural area that doesn't have
access.
Yeah, they don't have access to even the basic kind of healthcare facility, let alone something that has so much to offer.
Yeah. So I'm intrigued about chiropractic care because I've actually had care done that way, and I know that it involves it's physical. You're adjusting and the spine, which is the central nervous system. How maybe talk a little bit about your philosophy on how you approach chiropractic care.
I love that question, and it's a good. I guess, starting point to discuss the differences in chiropractors in general.
Yeah.
There are two, I'd say, major facets of our profession where on one side there are chiropractors who are very philosophically grounded. You mentioned the nervous system and its connection from brain to body. Their focus is removing interference of that communication. And the inclusion of what drives that life force through the nervous system to bring that information back and forth to the rest of your body. And so they're focused on the removal of a subluxation to remove nerve interference and allow life force to flow better through that nervous system. There's some religion literally incorporated into that. On another hand, though, there is more of an orthopedic approach to it, a more just musculoskeletal basis. Why is there inflammation? Why does that joint not move right? What biomechanics are off that are creating this dysfunction leading to pain? I have an appreciation of both. I tend to lead more towards the orthopedic approach. There is a dysfunction, and just like any machine that if the gears aren't lined up, there's extra wear and tear. Your body is not any different. In this way, though, it will lead to pain eventually as that turns into injury and degeneration, and that's what we're trying to fix.
Yeah, it's almost, in a sense, having a proactive approach as well. You know that something is hurting, get it fixed. Don't wait until it's too late.
Yeah, and that's the point of maintenance chiropractic as well. You're trying to prevent that small problem. It doesn't hurt bad. Maybe it doesn't hurt at all, but we know that that's what leads to 10, 20 years from now, that's when we see that really bad degenerative vertebra or shoulder on an x-ray. And it's like, well, you could have probably done something about it back then, but it's too late now.
Yeah. Yeah, very interesting. That's why one of the questions I was asking earlier was about what kind of cases do you see here in West Virginia? Because typically, I think about probably 20 years ago, you were probably seeing more work-related accidents or injuries, with physical labor, maybe working at a plant like Milan, being on your feet all day or something. That's gone. Coal mining, and a lot of that's gone. So curious about, is there something, intrinsic to North Central West Virginia that you're seeing and maybe treating more cases of?
That's true. There are still labor jobs and there are still people hurting.
Yeah.
So we still see that. And we have work-related injuries. One of the things that I don't know if it's just kind of on purpose or through routine, I guess maybe, but personal injury, car crashes, that whole world has been something that I've really become familiar with over the years. But probably not just epidemic to our area, more pandemic is our chronic postural problems now related to devices and screens and sitting.
Speak to that, because that's really interesting when you bring that up.
We can't escape it, and we just can't escape it. And as frustrating as it is, I would love to be able to go back to the 80s, and that didn't exist, right? But that has more than replaced the types of injuries that you're talking about.
Wow, really
chronic
interesting.
Neck pain, chronic headaches, the shoulder issues that come from it.
Because like the human head has a weight to it, right? The average head, I don't even know what it is.
We're talking 8 to 10 pounds
8 to
on
10
a head,
pounds.
and then you lever it forward. That's the problem. Is that as we start doing this more and more, that head on that 8 to 10 pounds becomes.
Oh, you're making me sit up straight now. It's just the thought of that.
So it's exponentially more heavy as the lever of your neck.
Of
the
course.
vertebra has to go forward, and so I was really awakened to this being a big problem the first time I saw a 22-year-old's X-ray of her neck was already showing signs of degenerative arthritis at C5.
Just because,
and that's where that would happen from such a thing.
Wow. I had a compression fracture of C6 when I was in high school, a football-related injury. Let's just call it that. It's a long story, Kevin. You don't want to know the details. But so I know, it can be debilitating having an upper cervical injury like that. But something that's almost self-inflicted, that causes me a little bit of heartburn right now.
Yeah.
And it's funny because as you're talking about this, just yesterday I was driving by, school just recently started here in West Virginia, and I saw, it must have been a bus stop or something, and there were, I think, four high school looking kids, and they were all just like hunched over their phone. They were all sitting on a step. Like they could have been having a conversation or cutting up or whatever, and they were all just hunched over their phones. I thought, that's a sign of the times right there. So it's just fresh in my memory just from a day or so. Like I said, it was yesterday. I think it was last Friday. But anyway, long story short is that is really interesting that you're seeing more cases like that. So thank you for sharing that as well. Sure. This is Positively West Virginia. We'll be right back. Stay connected with an unbeatable deal from BreezeLine. Voted best in Mountaineer Country for their reliable, high-speed fiber internet for a low cost, BreezeLine is the best gig in town. Here at Interaction Media, we rely on high-speed internet every single day to ensure we can deliver the best content possible for our clients and when we publish Positively West Virginia each week. That's why we use BreezeLine. It's affordable, fast, and they're great people as well. Learn more about BreezeLine's internet, TV, and mobile options at breezeline.com.
Your prescriptions are designed to keep you healthy, active, full of life. At Highmark Blue Cross Blue Shield, we're making vital medicine more affordable. Because when your prescriptions don't cost an arm and a leg, you can use those limbs for something more meaningful. Because life. Highmark Blue Cross Blue Shield, West Virginia.
Folks, we're back. We're visiting today once again with Dr. Kevin Trembush. He is the owner of Advantage Health and Wellness in Morgantown. They're a physical medicine facility in Morgantown. Kevin, let's jump right back into it. How do you get the word out? You're 20 years doing this. How do you get the word out there about your practice and attract new people to come to see you?
Well, like I said earlier, I mean, I got kind of jumped into business without a whole lot of no business experience.
Yeah.
So in the beginning, it was a lot of me running around and talking to people and shaking hands. And eventually, I had enough money to do some more conventional marketing. I'd say at this point, it's hard to escape the internet world, and you kind of have to have a strong presence there. So I'm figuring that out. I'm 50 years old. I've not grown up in the internet world, but I'm figuring it out.
Yeah.
But I still like the grassroots type of marketing the most, and where you get out and talk to people, shake
Relational.
hands. So we do one of the things that I really love about getting out in the public. We do a program, we call it a corporate massage program, where it doesn't necessarily have to do with a business, but we go offer chair massages in the break room. We'll put a sign-up sheet. Of course, everybody wants a chair massage, right?
Yeah.
But this is a good way for them to kind of first get an impression of us and meet us to a degree. So once we know that we're able to do that, we'll put up a sign-up sheet. The employees will sign up. We'll know who's going to be there and when, and we'll give them a quick chair massage, relieve some tension from the day. Of course, that makes your lunch break a whole lot happier. But they ask us questions about their health or their father-in-law or whoever it is, a relative. And they get some answers from us. And a lot of times that turns into people just knowing that we're there. And then when something comes up that they could use us, they're more apt to come in.
So good. It reminds me of the story you told about your first exposure to chiropractic. And what was his name?
Dr. Larry DeGarmo.
Yeah. I mean, you went to him because he made you feel heard. He heard what you were dealing with, and then he knew what to do to treat you. And I think that's really cool. That's relational. Yeah. It's hard to do that over the internet. Yeah, honestly,
it sure is.
You can to a certain degree, but that's super cool. So, what do you? In terms of 20 years in, I kind of teased you as we were warming up for this interview. I said, you just had your 20th year anniversary. I think you're going to make it. And you kind of laugh, but
is funny.
It's a lot of businesses make it 5 years and then they fail. Some will make it 10 years and then they just stop. And 20 years that's my hat's off to you. As an entrepreneur, getting ready to start our 15th year, I know that's you've had a lot of trials and tribulations along the way. In terms of growing the business now, you've got a lot of new energy. You're starting your 21st year, I guess. What's the biggest challenge you're facing in terms of growing now?
I don't know that there are going to be any different challenges than there have in the past. There are some, like you said, a lot of our local industry has left. That does affect us. But I feel like the future is looking bright in a lot of ways for not just maybe the return of some manufacturing to the United States, maybe to our area, but I think that there is an awakening happening in the general public as to our healthcare approach in this country. And so as Western medicine is faced with tougher questions, like do we really just treat everything with a pill? Is that the way this is supposed to work? People are going to have to start to question what health really means, and does it come out of a bottle, or do they have a responsibility in their own health, and is it more about their choices and then using a natural approach to pain, like say chiropractic and physical therapy? And I think that growth might be inherent for a company like mine. Growth may be inherent with that awakening.
Well, I think in West Virginia, obviously that's our focus here. And, for so long we have led the nation in all these horrible health factors, obesity, heart disease, cancer, you name it. And so we have a long way to go. And with traditional medicine, as you call it, Western medicine, I think is what you refer. I think there's a blend for that, and what you're doing, I think is very important. I think we've just got to get people healthy, and it starts with the individual, one person at a time. And whether that gets, I could see, what you're doing, and just if somebody has a debilitating back issue, for instance, back pain, like you were talking about, getting them mobile again is very important.
Oh, yeah,
because if you're not moving, you're in trouble.
Yeah, movement is life.
Yeah, movement is life. I like that. I believe that for sure. I've seen it firsthand. So yeah, I think that's really important. So my hat's off to what you're doing and your approach. What's the vision you have long term? I mean, 20 years in. I mean, what's the next 20 years look like? What's that? Do you have a vision for that?
I think yes, there is a vision for that, and I think it involves a whole lot less of me for this company, likely. Mm-hmm. But I want to be there for the next generation to pick up and move forward. So I think Advantage Health and Wellness has the potential to grow and potentially affect other communities in West Virginia. So I'm looking forward to that possibility. I know it's going to take some passion to do that, and I think that passion is going to come from, it's hard to believe, but somebody who's half my age probably to step in and take the reins. Yeah.
Well, it's interesting, because what you're alluding to, I don't know if this is the exact word you were thinking, but that transition where you have a transition of potential leadership or ownership. I mean, that's got to be a part of a plan of any entrepreneur, and a lot of times it's not thought about until it's too late. So the fact is, you're thinking about it. I know me personally, I started thinking about that 5 years ago. What do I want to do, and how does that look? And you can't just flip a switch and have somebody take the thing and run with it, because that's the legacy of the business, right? So you're kind of in that legacy mode and trying to determine that. Does that require planning and conversations? Tell us a little bit about that, as much as you're comfortable.
Yeah, well, if you've been also in that mindset, what you realize is that you don't know for sure what it looks like for yourself.
That's right.
So it's not that you're just answering questions in the interest of the company. That's right. But it's in your own interest too. Like, what does this even mean for me? Mm-hmm. So I think if a person in apparently our situation is actively thinking about it, you're going to try to find those answers. You eventually will come to them. I don't have them all yet for myself. Yeah. But it does take a lot of time. Mm-hmm. And then of course you're making your best effort to find the right person, your successor, and
succession planning.
And that may or may not happen for them too.
That's right.
Their goals may or may not.
It's really important to kind of talk about these things, because, like I said, you can't wait till the last minute. You got to be thinking about it. And one of the things that breaks my heart, there's a lot of things that break my heart these days, Kevin, but one of them is when I see a successful business and they just close and they shut down. And I'm thinking, dude, you're doing $5 million in sales. I mean, you've got a valuable asset here, and you just walk away from it.
Right.
And I had this conversation, it was probably a year or so ago with an individual who had a business. It was a service-related business here in West Virginia, and had like a legacy, been in business 25, 26 years, and was just going to shut the thing down. I said, why don't you sell it?
Yeah.
You've got an asset here that's, it's an income, it's a wealth building machine, honestly. And he just said, who's going to want to buy this? And I thought, well, if you have that mindset, probably nobody, Wow. But
sure.
You think about, because I talk about a lot on this program, because I'm an advocate and a staunch proponent of entrepreneurs and people like yourself that 20 years ago took a risk and started a business, didn't even know what you were doing, right? Here you are, look at you. But I'm an advocate, but you don't have to necessarily start something from scratch like you did. You can buy a business that's existing. Yes. You can, you could be a member of a family-run business and you kind of take the business over. Yep. You can start a new business from scratch like you did, or even a franchise model. There's multiple ways to become an entrepreneur and a business owner. There's not one path. And I would also encourage people to be thinking about that. If you're interested in getting into business, be looking out there for opportunities to become part of the legacy.
Yeah, I hope more people do consider business ownership. I think we need it.
Yeah, tell me about that. What's your experience from your perspective and your point of view?
I get worried when we continue down this road of corporatization of everything, and not that they're necessarily evil or it's a bad idea, but this private equity concept of just buying en masse all of these companies up to operate them in some non-small business way. Mm-hmm. I think it's going to lower the quality of everything. It's happening in healthcare. Mm-hmm. I mean, we see it. corporatization of healthcare, I think, is a net negative for the population.
Yeah.
But I really get excited for the younger kids coming out of college. I just wish I could tell them, like, here's a great path to follow, but nobody knows anymore. Artificial intelligence, I mean, who knows, right?
Yeah, everything is changing.
Yeah, how do you even focus your time in college on what to really study? Because the world could change in another 3 years again.
Yeah.
But I hope a lot more young people get into business ownership, because I think it's important for the quality of the service that you provide to your community. Mm-hmm. But there is great, like you alluded to, there's great opportunity there. And it doesn't mean that you have to go start a business. Mm-hmm. In fact, I was thinking about that on the way over here. That's an option, right? You better have some passion. If you're just going to start a business out of the box and you don't know what you're doing, you need passion.
Yeah, because something's got to sustain you.
Yeah. But if you get the concept of business ownership, you could also just get into a business for its financial return. You got to understand the economics of it. You have to understand the systemization, the importance of automation to simplify it. But that's a very rewarding path too.
Yeah, absolutely. I love it. Kevin, you're a successful leader, a leader in the community, a leader of your business, your family, your company. What do you think is the most important attribute of a successful business leader today?
I think you need to make decisions and take action. I all too often, I think people say that's a great idea. They say this is going to work. They say they're going to. They make a plan sometimes even, but they never take the first step. And as you start down the road of taking action, you need to be quick on making decisions. Sometimes you get them wrong. Just be willing to go back and fix them.
Yeah, that's great. I like it. I used to be indecisive. Now I'm not sure. That's a little joke. That's a dad joke.
I like it.
All right, so we talked about some advice you had for starting a business, but think about somebody who is out there listening to this. They're a young person maybe. Maybe they're in their career a couple of decades and are wanting to change, and they're thinking about starting a business. What would you say to them as advice?
I would say go in with your eyes open. Be willing to commit. It's going to take a lot of, or most of your time for the first several years. Mm-hmm. And it's going to take most of your time, let's be honest. But if you are impassioned enough to do it, or you just know, like I said, passion is one thing, but knowledge is another thing. If you have them both, great. But if you're just going in with the knowledge and you can run a business, great, it'll pay off. If you're just going in with passion and you're going to go work your butt off to make it happen, that'll pay off too.
Yeah.
Give it time, have a plan, but take action.
I love that. One of the things that I think about often is, and I wish I would have had this. There's this idea of proximity, being in proximity to people that are doing the work that you want to do.
Yeah.
And it would have been so much. It would have been a joy, a blessing. It would have been a gift if I would have had somebody in my industry to just say, before I start this thing, can you give me some like real life wisdom? Like, let me show you what I'm thinking about doing and tell me where I'm about to step into it.
Sure.
That proximity of somebody who's doing the work that you're wanting to do. Is that in your industry? Is that available? Is like somebody wants to become a chiropractor, get into healthcare? Is there a methodology to find somebody maybe in a different town or a different state, and you can kind of model what they're doing?
Yeah, I know I'm willing to do that, and I've met many people who are willing.
Like a mentorship.
Yeah, a mentor that you're not close enough to them to be a threat to their revenue, right? You're not competing, so to speak.
And I get the fact that some people have scarcity mindset versus abundance and all that. So
and that's prevalent in my industry. I'm sure it is in every, but no, I think there are plenty of people willing and have the generosity to welcome you in and say, yeah, here's how we've done this for years and it works. And then that you maybe take that home and apply it yourself. But I've always been a big fan of coaching. Like I still pay for coaching now. Yeah. 20 years into this, I don't want to act like I know everything.
I have a coach myself, so
I'm
the same way.
That's the number one thing is go get a coach, do it early on, and then always have a coach. The industry is going to change, whatever industry you're in.
Yeah.
Somebody who has their finger on the pulse of what's happening, more than in your region. Like everybody I work with is either nationally or internationally keeping a finger on the pulse.
I love that. And one of the things that I get out of coaching most is the questions that my coach asks me. They're like, oh man, you had to ask me that. I didn't want to really face that, but yeah, you're right. I know the answer, but somebody just to hold you accountable and ask the right questions, I think is invaluable as well.
Yeah.
So thank you for all that. That's great wisdom and great advice. Kevin, we've covered a lot in this interview. Is there anything else on your agenda you would like to talk about for your practice or even about your story?
Well, no, really, those were great questions, and I do appreciate the opportunity. From a healthcare perspective, I think it's important to close with, I'm excited about the future for healthcare in our country. I think we're going to see some really important changes happen.
Yeah. And
I think what you alluded to, the health of our people is going to improve. I think we're going to see great things.
That's
and
awesome.
on the concept of business ownership and entrepreneurship, I'm hopeful that young people really dive into it and start supporting their local community with small businesses. Mm-hmm. Something to push back on this corporatization of everything.
Yeah, I think it's so important. It's the here in West Virginia, it's those entrepreneurs, sometimes they're mom and pop shops, that it's that grittiness, that they're willing to take a chance, a risk, do something a little bit, maybe even against the flow. Those are the shops and the businesses we love to engage with, right? The coolness factor, if you will. But then those are also the successful companies too, that go out and do something a little bit different, find their way, use their passion, like you talked about, their knowledge, their wisdom, and be able to go out there and serve the community. And I think that, as we always talk about on this show, entrepreneurship, small businesses are the backbone, no pun intended, since we're talking about chiropractic care, the backbone of West Virginia's economy. Yeah. And there is opportunity here. You may not be able to find a job coming out of college at a Fortune 500 company in West Virginia. With remote work, you might be able to do that nowadays. But stay here. We got to keep our young people here, and entrepreneurship is definitely a viable way to do that.
Yeah, for sure.
That's awesome. Yeah. As we close out our time, Kevin, how can our listeners learn more about you and perhaps even get in contact with you?
I'm available through our website, advantagehealthandwellness.com. Also, obviously, we're located right in town, 699 Burroughs Street.
Yep, Morgantown.
Right here in Morgantown. Our number is 225-9355.
Awesome. And we'll make sure we have your website and all the social media links on our show notes, as well as when we shout this out on social media, so folks can get in touch with you. Our guest, once again, Dr. Kevin Trembush, the owner of Advantage Health and Wellness in Morgantown. Kevin, it's been an honor to have you on the show. It's great catching up with you. Yeah. We've been friends for a long time, and it's great to see you.
You too.
You look great, and I'm glad to hear that your business is doing well as well.
Thanks, Jim.
Keep up the great work, man.
Thank you.
Appreciate you. Folks, that's a wrap on another episode of Positively West Virginia. If you or someone you know would be a great guest on our show, drop us a line on our website at positively.wv.com. And of course, we appreciate you sharing these great stories of people like Dr. Kevin Trembush and his company, Advantage Health and Wellness, on your social media channels. It not only helps get the word about him, but also Positively West Virginia, and we really appreciate that. On behalf of our entire Positively West Virginia team, including our producer today, Mr. Jimmy Murray behind the controls, making us look and sound good, I'm your host, Jim Matuga. Stay positive, West Virginia.
We'd like to thank our partners, Highmark West Virginia, Freedom Kia of Morgantown, Interaction Media, Humble Influence, and our studio sponsor, BreezeLine, for helping to share these positive stories. If you'd like to become a sponsor of the Positively West Virginia podcast, visit positivelywv.com/sponsor.